In this video, we are going to show you how to run a screening rate for lipid panel. So from your main menu, you go to Setup, Charting Setup, CDS Query Setup. And we're going to create a new query. And so we will call this Lipid numerator. So what we're doing is we're calculating two different numbers. One is the numerator, so how many people got something done, and then the denominator afterwards, which will be the total population in that age group. So for the lipid numerator, we're going to put in some criteria. So first, from clients, we're going to put in the age range here for lipids, which is 40 to 74. And this will be for both genders. And we're going to do the screening rate for one doctor, so Dr. Bonner. The client type, valid Alberta patient. And then we save that line. So next, we're going to put a new line, and this will be for lab results. So the lipid maneuver requires that there are all three of the different lipid tests, so LDL, HDL, and triglycerides. So we're going to add each of these levels with an AND. So the result type, let's do triglycerides first. So it's really important that this name is typed exactly. Probably the best way is, if you're not 100% sure what it is exactly called, is to look back at a patient that you know has had the test already and get exactly the phrase that it has. So we're going to look for last result only, and we want this result to be within the last 5 years. That is the criteria. Okay, so then we save that line. Then we'll do a new line again, lab results again, and again we're keeping it the AND criteria. So let's put in, let's do HDL cholesterol. So again, this phrase has to be exactly correct with how it comes in to a patient's chart. Last result only, and the result date within the last 5 years. Save that line. And the third final line will be for the LDL. Now again, you have to get this exact, so I know that it's LDL, comma, space, calculated. Last result only, under 5 years ago. Save that line. Alright, so we have our numerator, so we're going to save the whole search, and then close, and then we're going to run it. So we see that we get 2 patients. So that is our numerator, is 2. Next, we're going to create the denominator search. So again, we go new, and let's put 40 to 74 denominator, and save. Then we put in the criteria, new line, oops, not lab results, clients. So again, we're doing the same age range of 40 to 74. And And again, we're doing it for just the one doctor, Dr. Bonner. And the client type, valid Alberta patient. So we have all of our criteria in, so we save the line, and that's all that we need for this search. So we'll save the search. So we're going to run the denominator report, and we see that we have 13 patients. So that is the denominator. So we had 2 for the numerator and 13 for the denominator, so that means that Dr. Bonner has a 15% validation rate.